Okay, Larissa, what are we going to talk about today?
Gastric POCUS,
What does POCUS stand for?
point of care ultrasound.
Excellent. All right, so point of care ultrasound is just a easy bedside tool to look at stomach contents in situations where NPO status is questionable. Okay, give me an example.
People on Ozempic.
Okay, what do we need to do this?
A curved probe.
So you're just going to place the probe in the sagittal position underneath the xiphoid.
Scan patient in both the supine and right lateral decubitus position.
Okay, so why are we scanning them in the right lateral decubitus position?
Gravity.
Yeah, so the stomach contents are going to spill over once you move them over to the right lateral decubitus, assuming that there are contents that are hiding from you. Okay, so we got an image here. So what is number 1?
1 is the liver.
What about number 4?
4 is the aorta.
What about 3?
Superior mesenteric artery.
And what about number 2?
2 would be the antrum.
Excellent. Okay, so we're going to focus on basically that arrow, the antrum. That's where we're going to diagnose our patient. Okay, so we're going to talk about the empty position. So you'll notice that you'll see kind of like a flattened oval, looks like a target. You see that kind of dark border and the kind of solid interior. That kind of looks like that. You can kind of see those layers of the stomach, the mucosa, the propria, and the serosa. So you squish that stomach together, kind of see how it looks like almost like a solid, so we'll just kind of review it there. And we're going to show you a couple more images here. The beam is going through. You're seeing here's an example right there. You see another example. Pretty soon this is just all pattern recognition. Okay, clears. How do we describe clears?
Starry night.
Yep, starry night. So you just see black, and sometimes you see bubbles. It's not flattened like the other image. So we call this the starry night appearance. And so, I made this little animation. You can kind of see the starry night. Going back, this is what the image looks like, the starry night, kind of this round, kind of big, just black ultrasound image. Okay, moving on. We're going to go to solids. Now, how do we describe solids?
Frosted glass.
Yeah, frosted glass. Yeah, so basically you'll see kind of like this kind of heterogeneous or just solid mass where the ultrasound beam doesn't really kind of penetrate through. So you often see shadowing like you see here. You see that? You see how the shadowing out? You can't really see beyond the image of the kind of the solids that are inside the antrum. So basically you have to ask yourself, what's the algorithm we use? Algorithm-wise, you're going to have empty, which is both empty in supine and lateral. They're going to have okay clears. That's going to be no clears in supine and clears in right lateral decubitus. Then there's not okay clears, which is clears in both supine and lateral. And lastly, you're going to have solids, which are never good. That would include thickened liquids. Okay, you ready for a quiz?
Yes.
Okay, let's do this. So what's that?
That one looks like starry night, so it would be clears.
Okay, very good. What's this one?
That one is empty because it looks like a target.
Excellent. And lastly?
That is solids. It looks like frosted glass.
You got it. For more information, visit www.gastricultrasound.org.